So we're going to talk today about things you can do in the community for caregivers. And I appreciate Todd and Ann are here from Community Living Alliance, which, full disclosure, is where I actually go to work during the day and night and other times, but because they let me. And so they're here to talk about something that we do as a fundraiser and they do as a fundraiser and how the board works on that. Carl, as some of you have heard about, Carl is a person who took action in his own person, right? As an advocate and did something there. And Rachel is part of the Miraculous Respite Care Association of Wisconsin, which, did people know we have a Respite Care Association in Wisconsin? Isn't it awesome that we know that? Because it's really grown. And Rachel is someone who travels the country and the world to talk about what the Respite Care Association of Wisconsin does for caregivers. So, right? Ramsey gave you a wow, right? So I think we sometimes think, oh, it's just us. It's just little Wisconsin. It's just me doing my thing. But what you guys, I think I was in control, always really wants people to remember. And the purpose of this conference is that Wisconsin's paved the way for a very long time. And we've only paved the way because individual people have raised their hand and said, well, that sucks. What do we do about that? Right? And as I like to tell people, when we see poop on the floor, we say there's poop on the floor, right? Like there's a problem over there. We're going to talk about it and we're going to figure it out, right? So that's how we got here. That's how we will stay here. That's how we will deal with some of the things that keep some of us up at night, right? In different ways. But none of that happens without caregivers, right? And there's often the situation in the caregiver world where we know we can't always pay people what we would like to pay them for the work that they do. So what we're going to do today is I'm going to do a little panel interview. These guys are going to tell you who they are. And then I will do interview round robin. Does that work? I'm giving you a thumbs up like you guys can nod at me. I don't know why I did that, but it happened. Anybody have any questions before I keep talking? Okay, I worked at TMG for a really long time and y'all need to stop staring at me that way. I'm afraid you start telling tales. Just tease it. All right. So first things first, I'm going to start with Carl. Carl, can you tell people who you are and how you've come to be in this space?
Hi, my name is Carl Scholze. I am a 45-year-old quadriplegic in Fox Crossing, as I said. I've been paralyzed 18 years. About 10 years ago, I came up with this. Well, I didn't come up with it. I seen this guy on National Geographic walking across the country to prove to the Russian embassy that he wasn't a spy because he's trying to walk around the world. And him and another guy crossed the Bering Strait. And when they landed in Russia, they were accused of being spies. So I saw this guy and I thought, I wonder if anybody drove their wheelchair across the country before. That'd be cool. And found out a few people did it. I spoke with them, got some encouragement. I was just had it for a selfish idea at first until Gabriel Cordell, he kind of got on me about, dude, you got to do this for a thing. And that's what got me thinking of, the caregiver crisis is loud. It's a huge problem in my life. And I'm just like looking around, like nobody's doing nothing about this. So for a couple of years, I had the foolish idea thinking I was going to cross the country, but that didn't really happen. I'm hoping it happens next year. But a year ago, I'm like, let's just go from my apartment down to Madison because really this is a state issue for me. And last summer, I wasn't really able to pull it together in the way I was hoping. So just this past summer, I'm like, I can do it with just my aids. I mean, it's a 2-hour drive to Madison and back. So that's 4 hours out of my 7-hour day with my aid. So I still got 2 hours I can drive down the road in my wheelchair and progress. So I'm just going to do it on my own. And I did. And I'm glad I did because I've gotten to know Patty and so many people in this environment. And it's pushed me to get out and be an activist because prior to this, all I've done was like most of us do. We just try to exist and be at home and, satisfied. But I just felt that I had to do something. And last summer it finally cracked. I'm like, if I can't even do it this way, then I guess maybe it's not for me.
You. So the next folks are going to have introduced themselves. This is These are the sweet people I get to see every day. I'm just going to let you know. So this is Ann Spiegel and Todd Costello. They are from Community Living Alliance. So is the man who's hiding his face back there, David Bailey. Everyone wave at David Bailey. Okay. So if you guys want to just talk about who you are and what we do is fundraising.
Well, first of all, thank you for the opportunity.
I need to do the mic, my love.
All right.
I don't know. Let's try. So if you want to tell them who you are and what we do at Community Living Alliance, that'd be awesome. Thank you.
Well, thank you for the opportunity to share our story. I'm Todd Costello. I'm the executive director at Community Living Alliance. And with me today, I'll let Ann introduce herself.
I'm Ann Spiegel. I'm Todd's executive assistant. I just make him look good.
All day. Really. And does all the good work, trust me.
She does.
But to tell you a little bit about Community Living Alliance, we are a nonprofit that is located in Madison, Wisconsin. We have been around for over 40 years, which is
well, not you and I, but
not right. We weren't around then, but the organization was founded by people with disabilities and other sort of stakeholders who wanted to have a different experience within the healthcare system. And so Community Living Alliance, we provide personal care services, behavioral health. We do a lot of in-home care. Even our therapy happens in people's homes. And so we're really proud of the services that we provide the community. Our goal is to really support the independence and dignity of all of our clients and the people who choose our services. And a big part of what we do are the caregivers. At one point before this workforce crisis, I used to stand in groups similar to this and say that CLA was 1,000 strong of caregivers. And now I get to say we're about 300 strong. And we serve over 400 clients. And so the struggle of finding enough workers is really, you know, part of our daily existence. But more importantly, what we've come to understand is just how important this workforce is and what they mean to people's lives. And I always, when I'm in this situation, I get to say, you know, as we sit here, unfortunately, perhaps someone had to spend the night in their wheelchair, or they missed a meal, or weren't able to use the bathroom because they didn't have a worker. And so what we do and what our caregivers do is so important. And so we'll talk a little bit more about why we wanted to find a way to celebrate and support them.
Thank you. Rachel, would you like to talk about respite care, please?
Yeah, hi, I'm Rachel. I work for Respite Care Association of Wisconsin. We serve all 72 counties and 11 tribes. Briefly about me, I started at the beginning years of the lifespan as a preschool teacher. I was early childhood education and gradually found my path to the other end of the lifespan and worked in long-term care as an administrator. And I'm loud. I've always been loud. I am, what's the word I'm trying to find? I'm like word searching. I am very lucky and I'm privileged that I'm able to call a spade a shovel and make change for people who might be the underdog.
Yeah. Thank you, Rachel. Appreciate it. So what we want to do is kind of draw attention to there's three different things happening, right? There's individual advocacy action, which is what Carl is doing. There is the Community Living Alliance model of we're going to fundraise and we're going to ask the community to say, hey, what can you actually give us in cash that will help us help people's lives in different ways? And then what Rachel's crew is doing at our CAW is going out in more formal ways, having grants come from maybe the federal government or other private, you know, entities that are investing in research or other pilot projects. And then Respite Care takes those dollars and increases the capacity of the system, right? So more helps to develop more opportunities for respite, more structure around training in different ways. So it's sort of it gets a little bit, what I don't, I'm hesitant to call the Respite Care Association grants and innovation as the most formal because it's really there's a lot of fun stuff happening in that space. Like Rachel, like you'll tell your own stories about fun respite camps. But so just want you to think about, don't freak out about the process. That's what I just want people to know, right? There's always someone who can help you figure it out who's done it before or whatever that bucket is. Okay. No fear, because otherwise nothing happens. Right? Okay, so we're gonna run through a little bit more of the specifics. So Carl, um, let's see. This is where we were gonna show the video of his thing. Carl, you don't have your governor or your Madison arrival video handy or no?
I don't know how I would share it with this venue. If I
I
was
wish I
live
could.
streaming, I could.
I know, hold on. Can't we pull it off the YouTube like we did yesterday?
We can do that.
We've still not received my. That's awesome. So Carl, tell us what you did this summer in July. And then what we'll do is we have a short video of Carl's speech from the Capitol, which is nice to see. And I also appreciate that we're getting to show you the YouTube channel because you can see Carl all the time. And in words that are, Carl, can you say it? Because it's against my brain. Carl, what's your YouTube channel called?
Oh, it's quadcarl.com or just my name, Quad Carl. That's me everywhere on the internet. Luckily, it's not taken.
I know, I love it.
So,
right?
I'm.
Go ahead.
You right? Are we good?
Yeah, Marcus has gotten the speech up. Do you want to start with the speech or do you want to start with?
Go ahead. You can.
Okay. Yeah, yeah.
Did I get everyone's attention?
Thank you.
Good afternoon, fellow Wisconsinites. My name is Carl Scholze. I'm a 44-year-old quadriplegic from Neenah. I've driven my wheelchair 125 miles to sit here in front of the Capitol to raise the alarm. People with disabilities on Medicaid, like me, are being left behind because our home health aides, the heartbeat of our care, are underpaid and undervalued. The journey was anything but easy, and every mile I traveled in this chair was a reminder of the strength it takes to live with a disability, and more importantly, the strength of the caregivers who make our lives possible. Home health aides are the unsung heroes who help us get out of bed, eat, and live with dignity. They're with us in our most vulnerable moments, yet they're paid wages that barely sustain them, sometimes as low as $12 or $15 an hour here in Wisconsin. Many leave for better paying jobs, and who could blame them? But when they leave, we're the ones left stranded. Without enough aides, people like me face a stark choice: struggle without care or lose our independence to institutions. That's not a choice. That's a failure of our system. And this isn't about taking sides. It's about coming together to address a challenge that affects families across our state, from rural farms to city neighborhoods. We all want a system that promotes independence, saves taxpayer dollars, and supports the hardworking people who make it possible. The facts show why prioritizing home care makes sense for everyone. Nationally, the median annual cost for full-time home health care service is $62,400, while a room in a semi-private nursing home is $116,000, almost twice as much. Here in Wisconsin, expanding Medicaid coverage could lower state healthcare costs by $1.9 billion over the next 2 years, while extending services to nearly 96,000 more low-income residents. Beyond dollars, home care improves quality of life. Studies indicate it reduces hospital admissions by up to 25% and enhances medical health outcomes by allowing individuals to stay connected to their families and communities. A lot of people don't know that family caregivers shoulder 80% of long-term support, and strengthening home care eases that burden while creating stable jobs in our local economies. This issue transcends party lines. It's about smart fiscal policy, strengthening our workforce, and upholding shared values like self-reliance and compassion. By investing in home care, we can reduce costs, prevent unnecessary institutionalizations, and ensure dignity for all.
Wisconsin has always been a place where neighbors help neighbors. And together, we can build a healthcare system that reflects that spirit. I didn't make this journey for applause. I made it because I believe Wisconsin can do better. Let's build a future where no one on Medicaid goes without care, and no home health aide has to choose between their calling and a paycheck. I'm here to demand change, and I won't rest until it happens. To our lawmakers, let's unite and increase wages for aides. Raise reimbursement rates so agencies can pay aides a living wage of $20 an hour or more, with benefits that show they're valued. Increase Medicaid funding for home health care. Increase funding for community-based programs and streamline access to services. To the public, see us, hear us. People with disabilities aren't invisible, and our caregivers shouldn't be either. Join us in pushing for a system that works for everyone. And to my fellow advocates, you guys know who you are. Keep fighting. You guys are awesome.
You're awesome.
Your voices matter. Your voices matter, and together we can change lives. Thank you.
I've worked here for nearly 33 years.
So, I'm not my. Carl, how was the trip?
It was hot.
Okay.
Turns out July isn't really the coolest month to be doing that.
Yeah. What
But it
happened on day 2?
Day 2, I didn't have day 2. Day 2, an aide called in.
Yeah. So that was, yeah. Do you want to tell that? So yesterday we were talking a little bit about like what the resilience was of getting from day 2 to day 3 to day 4 for you, and how to orchestrate some of the, what do I want to say? Like, how did you plan where to stop in that space? Do you want to talk about that a little
Okay.
bit, please?
I didn't even plan where to stop. I was just like, I'm going to just drive my wheelchair until the battery dies. Like, I'll get to 5% battery so that I can drive up into my van and my aide doesn't have to push me. But I just thought I'd go for it like that. Luckily, every day I get to like 15 or 10% battery, and then I just pull up Google Earth real quick or just look over at the horizon and kind of guess. I think we'll get to that next driveway or that next road, and then I would remember where I left off that day. And on an ideal day, I would go home, plug in my chair to charge my batteries that afternoon and then overnight, and then pick up the next morning where I left off. Now, as Patty was saying, I think there was at least 4 or 5 days that I didn't have an aide on the day that I was going to travel. So, and that added like other complications because I do other things with my aide besides drive to Madison on these days. We still got to squeeze our cares in and all of that as well. And unfortunately, as most people in the room know, all that goes to the wayside.
Mm-hmm. Thank you. Thank you. Thank you. So, we're going to move to the fundraisers and talk a little bit about what you guys have done. Can you share what does CLA do related to fundraising for caregivers?
Yes. One of the things that we learned for our caregivers, as Carl has mentioned, they're underpaid and undervalued. And so we were looking for an opportunity to really demonstrate how much we value the work that they do. And oftentimes we had found that there were barriers sometimes why they couldn't do the work. Their car may have broken down, or they may have an illness that they need to seek care for, but perhaps can't afford the copays. Sometimes people are on the verge of becoming homeless. A lot of different things that would prevent them from perhaps doing the work that they would like to. And so we realized that sometimes life happens, and we wanted to be in a position where we could help. And so we decided with our board to begin a fundraiser that we could use money, because we just didn't have money that we could give it, because most of the funds that we receive is through Medicaid and the rates that we receive for that work. And so this was a real opportunity to, one, support our caregivers, but more importantly, raise awareness within the community of how important this work is. And the truth is that every one of us at some point, and I'm sure you've heard this before, that you'll either need care or be providing care to someone in your lifetime. And so how can we begin to educate the community to the importance of this work? And oftentimes people are wanting to help, but they don't know how. And so this was a great opportunity for people to maybe step up. Some of our business partners, some of our community partners. And so I think that we found that more people wanted to support us. It was a slow and long journey. Our first fundraiser, I don't think we made a whole lot of money. We ended up having to pay for a band and a venue, but then it grew over time, and we can talk a little bit more about that. But we get to do a lot of good things, provide gas cards and birthday cards and incentives and giveaways and, all kinds of things that we can do to support our caregivers.
Rachel, do you want to share a little bit about the grants in RCAW and how you guys work on pilots and innovation? Well, you might be on mute, my friend. I can get him. Oh,
I was on mute. I'm so sorry.
you're doing.
I think I'd learn how to do this by now, but still will find myself on mute talking.
It's all good.
So RCW, we have lots of grants. We depend on state and federal funding. I will say it's scary times, so I need everyone to get loud with me. But we're continuing to still advocate and do some really cool things. We have some grants to support family caregivers. We also have grants for individuals who want to start programs, a worker-owned co-op to try and increase the workforce across the state of Wisconsin. And luckily, we are seeing some movement there. And the co-op model can be super beneficial to someone who has the heart and the knack to be the caregiver, but might want to have more say and ownership and policies and procedures. So that is something that we just love. A lot of our grants support family caregivers, and I know that this is more geared towards the paid caregivers, so I'm kind of leaning into that. So definitely check out the slides or the images and the grants. If you're a family caregiver in the audience, absolutely, I can get more into it. But I just wanted to let everyone know that we do have a nationally piloted online free respite care provider training. And it can be used for people who want to provide respite or someone who, wants to be Carl's aide and learn about, disability basics and communication and things that someone who might not have ever done this. It is a beginner level training, but we're seeing a lot of success across the state. And now that we have the national respite care provider training across the country. So I just want to, there's kind of a three column who can take that course. Those who want to provide respite care and support family caregivers, those who want to go through the 10 courses and support people living independently with disabilities. We also have family caregivers take that training. I am going on and on, but the group respite grant, that's for agencies. That is to do, a lot of times family caregivers aren't able to attend things like support groups or educational series or conferences like the SD conference potentially. And agencies can apply and provide respite at a group level. We also get innovated with how those dollars are spent and host memory camp each year. That's for people living with dementia and their families. It's a lot of fun. Startup respite grant. I'm like throwing so much information at everyone.
No, you're going to do that, and then I'm going to come back and ask you some specifics. So you keep going.
Oh, I love Patty questions.
I know.
I'm just kidding. The startup, that is for individuals who complete our workshop, Bringing Respite to Your Community, and want to start a new program or business in Wisconsin.
Thank you. Rachel, do you want to talk about the memory camp? Because I know you go to it and you really enjoy it.
Yeah, I can do it without choking back tears. It is like the best week of the year. It's just been listening to Carl's story and like today in this advocacy. I don't know what is happening, but I'm getting emotional. But I'll pull it together. Memory Camp is awesome. It's a week of respite for families and their loved ones with dementia. They get a respite volunteer, and we have fun from sunup to sundown in the Northwoods of Wisconsin. Because oftentimes in Wisconsin, people who are fortunate enough, they can go up north to their camp or their cabins, and they're used to lakes and the outdoors. And so many people, not only people with dementia, people with disabilities can be really deprived with nature, and that's medicine.
Yeah, that's awesome. So I'm going to go back one, if that's okay.
Yeah.
So I think when you mentioned about, we talk about the paid caregiver, but as we all know, there's a lot of family caregivers who are unpaid. And if they weren't doing the work, there would need to be someone to do that, right? So
Yeah.
we think about the whole. Rachel, and also I'm going to just shout out to David in the back, are part of something called the Wisconsin Family Caregiver and Support Alliance. I encourage you all to get connected, or encourage families and paid caregivers to get connected to what is known as WAFASA, because it's fun to say. But it is also really, again, capturing for the whole state of Wisconsin what is happening in both the paid and the unpaid situations, right? Because if we had more paid people, right, caregivers could be parents instead of caregivers, right? There's that space of relationships can go back to what we know of natural relationships. So one of the things that, here's a tip for y'all. When sometimes, Phil Clissa that is standing and talking about the conference at different times, if you call her and say, hey, Phil, did you hear about this thing the Respite Care Association did? And they were at this conference in Montana, and there was this way that they did it. And I think you should do that in 26 at the SD. Phil will say, Patty, you should do a session on that. And here we are. So the healthy meals, healthy minds that you shared in a board meeting that I then said to Phil in about 20 seconds turned into today. So where that long drawn out story is going is that sometimes we think the thing we can do for someone is raising their hourly rate as a paid caregiver, right? What do we do for the unpaid caregiver? It's helping them get more respite, helping them get more care in there. RCAW figured out a way, very similar to CLA's Caregiver Fund, to do a little bit of something for family caregivers that then enhances the overall experience for everybody, right? So can you talk about what Healthy Meals, Healthy Minds was, and how awesome it is?
Yeah, I sure can. This exact program, the exact title. This is something I applied for from a different funder a few years ago and got shot down. So I just take that as a lesson that you might hear, regardless of what you're going after, you might hear the word no first, but you keep going. So this program, we received federal funds, and it provides part of the national strategy to support family caregivers. Goal number 3 is increase services and supports. And under that really powerful goal, number 3 is nutritious meals. And a lot of times caregivers in families go without. I won't get into the rabbit hole. You can all imagine what the why behind that is. But eligible individuals, feel free to contact me more after this to do a deeper dive if you'd like. But allowable expenses are home delivered meal kits, right? Because I don't know about you, but just thinking about what's for dinner, planning what's for dinner, making what's for dinner, cleaning up, that's a whole mental load I don't want to do as a current family caregiver myself. Also, individuals can use that towards anything towards mental health and wellness, and you can reapply every 2 months, and it's $250. So it could be $1,000 a year to help individuals.
Thank you.
Yeah.
So that's, again, another one of those, like, it's a little thing, right? It might seem like a little thing, but to have, okay, how many of you tonight are going to have to go home and figure out what to make for dinner, right? And at the same time, provide care to someone and worry about what tomorrow's going to look like. And what they're doing online and who they're, and what did I set up that trust, or all the things that run through all of our minds as parents in general, and even more so as folks who care for individuals that have disabilities. So the idea when I heard about this, that like, oh my God, I could get home from work and rest, but I didn't do it because I'm on the board and that would be wrong. But somebody would just, the HelloFresh box would be on my front porch and that's what I eat tonight. That seems, do you see, are we seeing how that frees up your mental space and helps you feel healthier and stronger and all the things? Okay, thank you for nodding at me. So the next thing I wanted folks to talk about, because we are going to do a small group activity, because I like to challenge you to think about what you might do yourself. But I also want these guys to help you think about what are the like 3 things you should know or what to know about as you're moving forward with this stuff, because there's nothing better than someone with lived experience, right? Sharing with those of us who are just exploring. So I'm going to start with Carl. Where'd Carl go?
I'm still here.
I know. He's there, like
I'm a ghost.
above. Carl, what would you want people to know if they're going to decide to start and do an individual action, particularly something that's going to span over time and had a couple safety risks?
I would say definitely try to make yourself a nice clear-cut plan. Oh, my camera cut out. That's why. I definitely, you want to, make out a list, get as many bullet points as you can think of to try to make this as simple as possible in the end, once you implement the advocacy of whatever you're doing. I thought that my idea was super simple and I could just go at it like a bowling ball. And as I was doing things, turns out just driving your wheelchair every day till the battery dies is way more complicated than just driving your wheelchair till the battery dies. So I would say try to really list out as many things as you can think of that might come up ahead of time so that when it comes time for the action, you already have contingencies and have thought of things.
Fantastic. When you were getting, so contingencies and plans, I'm going to make you tell that story I like about the railroad tracks.
Oh yeah, railroad tracks. Nobody is interested in getting their wheelchair stuck in the middle of out in the middle of the country in some railroad tracks. So and actually there's the Loop the Lake Trail in Neenah that I like to go around in my wheelchair. And that happens to have a really nasty set of railroad tracks to cross if you wanted to go into downtown Neenah. So there's where I got the idea to use this Yucca board stuff that I actually have around the house so I don't destroy my carpet. And we just took a couple pieces of that to bring with to cover the tracks. So it was really lightweight and easy for my aide to use. But I mean, could you imagine getting one of your wheelchair tires stuck in the railroad tracks out on county who knows what?
And on 98-degree day in July in Wisconsin.
Oh, goodness. And there's a train coming. It's a half mile away.
Train coming. He's just written a short film. So again, I think so if you go to Carl's YouTube channel, there's
Can you
videos
wiggle my
of the
cameras?
trip, right? And when I was watching one day, I watched this moment where, again, the value and the
Wiggle
amazing
the cord.
is a direct caregiver who is committed to the cause, to what they're doing. And Carl's caregiver came with him to Madison when he did the speech, and we met her there. And I'm just really, she would have done anything for you, and I think still would. But you can see it's so she would drive ahead,
Plug it and plug it back
get
in.
out, put the Yucca board on the railroad track, and then get herself another half mile or so ahead. And then Carl would come through, go over the railroad track, and she would come back and get it. And then they would take it to the next place. And when I was watching that day, I was like, I didn't even think about in my head, right? In my life experience, I just drive my car or my bike over a railroad track. I don't think about what's going to get stuck in there. I never tried to put a stroller over one or such, but it was a moment where I was like, this has so many little important planning points for him to be doing this in different ways that you wouldn't think about till you see it. But it is also a lot of very beautiful Wisconsin countryside in the summer you can watch. All right. So Todd and Ann, what would you like people to know?
I think what we would say is start small, know your goal, share your story, figure out your touch points, and I think it is be personal, know your circle of influence, talk to the people that know you and revisit and grow it slowly. We started where we made very little money to now we make quite a bit, and we were able to lift some of the, people could only apply for money once a year and had a cap of $50 to now, we just paid somebody's back rent for $1,700.
Mhm.
So it's changed their lives. And so don't be afraid when it starts off just a little bit. A little bit matters, and it will grow. And don't lose confidence.
Hey, Ann, what are these things in the upper left?
Those are chickens. So we did start off really small, and then when I started, I really like art fairs and things. So I go around and I'm like this goofy stalker. So I get everybody's business cards and
Yeah.
I hit them up all year long. I do the fundraiser all year long. So people are hearing from me repeatedly, and I'll say, "Oh, I saw you at this art fair, or I saw you at this." And then they donate all these weird things. And so our silent auction went from being very small to being almost an entire room. And those chickens were donated this year, and we got $200 for them. It's crazy.
Yeah. I think
They're super creepy.
they are I think my lesson this year was like, you take whatever comes.
You take,
Right? We
you
brought,
take
like,
whatever comes.
somebody really wanted
And
those.
we made like all these baskets that had, some people like Quick Trip will give you $200 worth of gift cards. So you like add them to add value to all these baskets. And I mean, we had a ton. The bottom thing is our cork pull, which has grown crazy amounts of that. That's a great thing for our boards to donate. They donate a case of wine. So we keep adding to that. People pay $10 a bottle. You end up with, crazy lots of liquor. Yeah, lots of liquor. This year we had Mark Croft's duo come, which is perfect. We do it at the Brink, which has this kooky window thing there, which is lovely. We also honor our longevity caregivers who've been there for over 25 years. So we have caregivers come. It's changed every year. It's grown into this lovely celebration of caregivers and people and repeat donors. And this year we raised over $25,000. So it's been lovely. And we were able to give 237 caregivers $50 gift cards to Woodman's unexpectedly this year, which allowed them to get gas or oil changes or groceries or whatever they needed, and things like that we never would have been able to do. So it's something that has grown and been lovely. So
What-
start small.
I'm going to ask you one other question, then we're going to have to talk about Caregiver of the Year award for a second. But what happens every month? What do you do every month, Ann?
Okay, every month, I draw two random caregivers' names and I give them goofy gifts. I don't know how
You're always really useful. She says they're goofy, but Ann is the best gift.
I don't know
basket
what
giver.
happens. I just get obsessed. I only have a $50 limit, and so they each get a gift. It's a random drawing, but I give them like foot massagers and shiatsu. I don't know what, or herbal gardens or whatever it is, and I just randomly give it, and then their nurse goes out and gives it to them as just a surprise gift. So every month they're in a random drawing just to say that we appreciate them. Family Caregiver Month, we do something once a week, and we often ask them to tell us like their tips, and then we use our caregiver fund to give them gifts for that. And then we do our caregiver gifts. It's named the Bob Dice Caregiver of the Year Award. Bob Dice was a former employee for CLA who passed away. And now we get nominations from our clients and our nurses. And this year we had 5 recipients and then a team of caregivers that received the award. This was just last week. They each received $500 and a name on the plaque in appreciation for the special work that they do.
Thank you. Yeah, so I think the idea of it's always growing, right? And then also I'll just say, I appreciate as the person who is I supervise our nurses and our therapists, and that a lot of times for those of you who go in and out of people's homes, sometimes you're going in and you don't always have the best news, right? Or you're coming in one more time for you to show me how you take a shower or whatever, that sort of moment. And what we really appreciate, I know my team appreciates these gifts, is every month you're going in with the surprise, like the prize patrol. People don't know they're going to get it. The nurse shows up. They've got a, hey, I've got a foot massager for you to use when we leave. And it develops some, it's a different exchange than we didn't get your EVV on time, right? Or something else has happened. The world is gray and dark sometimes. So the little, again, it's $100 a month, right? So we spend $1,200 a month on this thing that the reward is tenfold back, right, for the person. And then we like to have parties. I was realizing I was putting all of these things together over the weekend. I'm like, CLA has a lot of parties, but that's the point, right? Like, let's give everybody an opportunity to celebrate. So that just keeps going and starting small. This is I just threw these together because we've done rent. We've also had, if somebody like car repair. So if someone can't, like I got a flat tire, I can't come to work tomorrow, we're going to figure out a way for the caregiver fund to fix that tire so someone can get to work tomorrow. You mentioned the rent, and I just want to, can you tell me more about how we might work on that request in a way
Yeah, that request,
yeah.
when that request came, it was sort of an interesting thing because it's not like they just kind of say, oh, by the way, I'm $1,700 in the rear. And we just get a check for them. They talk to like somebody in the building and that person says, we have this PCW who is going to be evicted. So then we have a committee that has to approve any money that comes out of the caregiver fund. We're stewards of that money and not everything gets approved. And initially, we talk about it. That's a lot of money for us to pass out to one person. We have a lot of caregivers and a lot of need. So the conversation goes back and forth. And the question was, kind of how did this happen? Are you making payments? And she sent us, like, we got a thing from the landlord with a receipt of what she had paid. And you could tell she was making like, $22 here, $36 here. Like she was trying hard to pay all the time whenever she had a little extra. She lived in a co-op and she stopped paying her $100 a month for food. Like she said, I don't need the food, I'll just keep paying the rent, So she wasn't even going to get this food benefit. So she had brought down her cost. It was really only like 2 months behind, but she was still like eating away at it. We talked about giving her $500, but that wasn't going to make her whole. She was going to have to keep going at this back pay. And finally, what the committee decided, it's a committee of 5 people, is that if we brought her up to whole, she was going to go forward. Like that was the deal, like it's a lot of money, but she was going to be able to pay forward. And the note we received back after we decided, we sent the money directly to the landlord. It's not like you send it to somebody and say, oh yeah, we'll try to pay off your rent with this. Nope, it goes directly to the landlord. And what the note we received back is, I am now ahead in my rent and I like to sleep outside, but I like to choose when. That's pretty big. And this person, we looked at her job history. She was covering a lot of hours. She picked up where when we needed her, and was nominated for Caregiver of the Year this year and got it. So this is a person that, goes above and beyond, and we were able to help her and she showed up for more. So it was a lot of pluses in that column. It's not like it's an easy, like, oh yeah, we'll just write a check. There's a lot of checks and
Yeah,
balances.
thank you. Thank you. And I think the other thing I'll just add sort of back to that idea of community and a fundraiser where you're going to reach out to folks because some people, there's that moment of we've had car repairs and Ann talks directly to the car repair guy, right? Like builds that relationship actually with that auto repair shop, basically, which just going to tell you is a whole nother person to ask to sponsor and donate to the fundraiser the next year, right? So what you're doing is opening the door or breaking down the wall around your agency and the problem by saying, hey, neighbors, we're over here. We've got someone who needs a car repair. We're going to pay you directly. And this is how that's happening. And it allows us to keep sharing the story of the crisis. And most importantly, that there are people in your neighborhood with disabilities who are living here and getting support, right? We always say if we're doing the community support well, you don't know we're doing it, which makes it real hard to fundraise for. because nobody sees it. So this is one way we can do that without drawing attention to.
The other
Yeah,
thing
go
I
ahead.
just wanted to add is that there's a company called Hooper. I don't know if you ever heard of Hooper. I don't even know what they do. I think they drive big trucks. And they're on, like, if you're on 51 heading out towards Poinet, they have a big Hooper. And I don't know what Hooper does. I live in Poinet. I drive by Hooper. So I contact Hooper and say, Hooper, do you want to like put some money towards our fundraiser? And Hooper says, yeah.
Mhm.
I don't know what Hooper does. Hooper is a company that drives big trucks and they don't know anything about what we do, but I write them this letter.
Yeah.
And my husband pulls over at the gas station. And the guy gets out of this Hooper truck and he says, hey, your company sponsored my wife's fundraiser. And he goes, oh, really? What does your wife's company do? And they have this rapport back and forth. And the guy goes, oh, that's awesome. And now they've been a repeat donor.
Yeah.
Nothing to do with CLA. I'm just saying, people want to help.
Yeah.
So even if they have nothing to do with your industry, reach out.
Mhm.
You never know.
Thank you, Ian. Excellent point. Rach, is there stuff you would want people to know for steps to advise about? And then we're gonna break out into a little small group.
What time do we have? Yeah. So,
Do I know what time it is? Is that what you
No.
said?
yeah, how much time do I have? I know we have a small group activity. I'm gonna let the slides tell the story and encourage anyone to reach out to me with any advocacy questions because I would say since January of this year, I've really had a fire lit underneath me in advocacy, and I'm looking for people to partner with. So, why don't we break out into small groups and
Okay.
talk
Could
more?
you, before we do that, because I think, just want to ask, because you mentioned federal funding.
Yeah.
Do you want to make any comments on kind of where that sits and how you guys have worked to make sure people were aware? I don't know.
Yeah, I mean, we're very transparent on our website, www.respicarewi.org. We've been told that during past shutdowns that there was not an issue with Lifespan Respite getting funding. However, I do want to point out that the Lifespan Reauthorization Act it's not reauthorized. So every day is a new day, and every day is another opportunity to call legislators and tell them how it is.
Ramsey, do you have a question? Comment of the such? Comment?
I just wanna say thank you to CRA for what they do. I'm not super familiar with it, but that's awesome. And then I want to remind everybody that there is an exhibitor out there that is called Wisconsin Caregiver Career Pathways, and they have a program that would provide training. That if you take the training, you get a certain amount of incentive, and then if you stay there for I think in 6 months you get another check. But the question I had is for people that are moving or thinking about moving to the Madison area, how do we get on your waiting list for care?
Well, a couple of things. Yeah. So I'm gonna Ramsey. So two things Ramsey said. First thing is there's the Wisconsin, do people know about the Wisconsin Caregiver Career Training, wiscaregivers.com, and it has a registry and a training, and it what's really exciting about it as well is it includes a basically a certification that hasn't existed before. Again, on the side of Wisconsin leading the way, the Certified Direct Care Professional situation in Wisconsin is is something that is leading the way. Not every state has that, right? So it does also in the loveliness that is Wisconsin for folks who take it. They receive a stipend once they finish. And then if they are with an employer that is also registered, and that can be an IRIS personal, like you can be an IRIS employer, right? Individuals who are self-directing in IRIS or agencies or self-directing in family care. If you complete that training, stay with that in that caregiver job for 6 months, there's another $250. So we do, and David is running, like he was just going to sit there all humble in the back, but there's a direct link for every on the CLA learning management system of, hey, go take this thing, right? And we really encourage folks to do it. It's a nice setup. It complements really well with the Respite Care Association's training, and there's different badges and all of that, those things. It feels Todd and Ann, would you like to talk to people about how they connect to CLA if they would like services? And are we just in Madison? And then we'll stop selling ourselves. Oh, I might have turned it off, buddy. Oh, you took great.
We are actually in 11 counties surrounding Dane. We have an intake department and a number on our website. So if anyone would like to receive services from CLA, or if you know of a caregiver who would like to work for CLA, we would more than welcome that.
Yeah. And I think there's a CLA table stuff stringer. Our community partnership person is out there. The other thing I'll just say again, because I've worked at CLA for the last 5 years, but stalked Todd for probably the last 20 some in this workforce space. So what I will say that I've always appreciated about CLA is it's looking for that other opportunity of how to fill the gap, right? So when we talk about how we make sure and help people have care, one of the things we do is actually partner with supported living agencies to help them have, we basically subcontract out our MA personal care certification. So we send the nurses. For a lot of folks that are using IRIS, if they need to capture their personal care, they can use SDPC, but if they are looking to live somewhere in a community supported living situation, SDPC doesn't always work real well there because you have 2 employers in one house, and my HR friend in the back will tell you that's bad. So it's risky in lots of different ways. So where I'm going with this is we bought that CLA long before I arrived, figured out a way to partner with agencies to expand the opportunity to get services to people in their own homes versus in facilities or congregate settings. And that has in the last year brought us all the way over to Ozaukee County. So we now we can go lake to Iowa, I guess you would say at this point. So that's if people are interested in that idea, family governed, all that stuff that everyone knows not everyone, but most of you might know, gets me really excited. The creativity is there. Okay. My friend Lisa, what time? Thank you so much. Does everyone know Lisa Steffen from Manitowoc County? Now you do. Well, and Lisa runs a kids program. So now I'm just going to poke at you because you and I have been in this room together lots of days. What do you think people can do for children caregivers? Is it a similar advocacy space, or what do you see in that kids world? Oh, I should bring his mic. Thank you, Brett.
Now that I just think
I turned it on.
Yeah. See how I can turn it back. Here we go. There we go. So I work with the Children's Long-Term Support Program in the kids world, and I just emailed myself, make sure our case managers know about Wisconsin Respite Care Association of Wisconsin, because they've been around a long time, but we have new case managers all the time. So that's my to-do list when I leave here, making sure that we're spreading that word. And also the caregiving training. I mean, it's an easy way to make money. That can happen in Children's Waiver too.
Yeah.
We have families that are hiring their own caregivers. So making sure that people are aware of that. So
Thank you. I appreciate that. I think that's that example of so from the lens of that CLTS service facilitator, they're seeing a family kind of worn out. How do you help them? Right? What I do. Oh. Did you notice how I heard my coworker's voice in the back of my head ominously? And I went, "What I do?"
Carl's YouTube channel.
Good call. Carl, we have a question about your YouTube channel.
What you got?
I think we want to know what it is.
Yes.
Oh, it's just Quad Carl.
Wow.
Yep. QUAD and then Carl with a C. Okay. So our 20 minutes is what's between you and lunch. I think rather than break into little groups, I think if you guys want to do some questions. Did someone say my name behind me?
The tables other than this person here.
You don't. Doesn't want you doing the group, man. I thought what we could do is as a group. So I'm going to do like a quiz. Does that work? So does anyone, as you've been sitting here, have a thought about how you might do an individual advocacy action? Anyone ready? Thoughts? Hopes? Dreams? Stand outside, yell real loud. Not so much. Example of something you might have done in the past? Okay, I'm coming back. Coming back.
Not me, but
Go ahead.
not me, but my dad. We live across from a park and people speed on our streets.
Mm-hmm.
Live in Milwaukee.
Mm-hmm.
So what he advocated for was to get speed humps installed
Okay.
to slow people down and keep the kids safe.
Yeah.
You know?
There you go. Thank you. What about so let's think, we're going to think about what's in the not space, right? So what is it that's a gap that sometimes, I know you all think about it. What's that thing where you're like, God darn it. Why does this keep happening? Nobody has one? You have one? Okay.
Well, most people walk through with their clothes on, and the bikes, everything. I saw bikes and kids in their clothes, and I hope save and not get hurt.
All right. So people should work on being safe and not get hurt. Is Leanne going to help me if I missed anything?
It's pretty much the bike safety.
Bike safety?
Yeah,
In dark clothes.
Well, bike safety is important. Carl has a story about Carl, did you need bike riders when you were riding your wheelchair?
Yeah, it's not necessarily a bike safety issue, but if you're going to try and do something like I did, definitely have a friend with you out in the country, because I forgot that most folks in the country own large dogs and don't keep them on leashes.
Yeah. So I think it's a good story. Because it gets, and I think that's enough to the point of your list of all the things you don't always think about till they're happening, right? Like thinking about the fact that those dogs were just there. They didn't expect the wheelchair guy to come around the big truck in front of a rural road between Beaver Dam and Ripon or whatever, right?
Yeah, I wish I remembered the name of the road that I was on, but my caregiver was parked about a mile in front of me waiting for me to arrive, because we're just playing leapfrog and I had plenty of battery to go. And I'm like, well, okay, here's a quiet, empty road with nothing but fields on each side and like 3 houses. I'll see you up at the next intersection. And as I'm going by one of these houses, there's this big old Dodge Ram jacked up, like on the little side turnaround part of a driveway. And I'm just kind of looking at it because they mowed real close, but there's like 3 foot tall weeds around it. It just looked kind of interesting as I'm tooling around all by myself, not a car in sight for miles. And I get around to the front of this truck. There's this big old Siberian Husky that was laying down in the shade, trying to hide from the sun. And it saw me. And I bet I traveled 8 feet the time I saw it till the time it got up next to me, because I'm only going 6 miles an hour. We're going as fast as we can in the chair, but it's only 6 miles an hour. So thankfully it was not an aggressive dog or anything, but it was like right up there sniffing my arm and stuff and jogging along next to me for a good 50 yards before it decided it wanted to just stay home. So yeah, that was stressful.
Yeah, yeah. The other, so I'm just gonna say, the other thing that Carl does in that individual space is there is social media, right? Different times where you're live streaming or you're reaching out and sharing. I don't know if there's, and that always seems that there are people who want to do it, right? People want to be the YouTuber. I don't know if anyone has any questions for Carl about how that works and if you would ever want to do it, or other people have questions for Anne or Todd or Rachel. No questions. You know what? It's almost noon on Wednesday. Your brains got filled up. Go ahead, Ramsey.
Steal your thunder, but I know yesterday you mentioned you're looking for 5 people
Yeah.
to travel across the country with you in July. You need to drive a van, and I can't remember what all you needed.
I'm gonna.
I
So, go ahead. So Ramsey's asking Carl about your plan for 26 and your need for 5 people to.
Yeah,
Todd, FYI, Todd, I might need some time off next summer.
I got a few things on the front of the plate here, but one of the biggest things is cracking down right now to actually later today, now that I got my shirts made, I'm making some promotional videos to start putting out on social media because my goal is to cross the country next year, midterm elections. It's time to make noise nationally. And I got a lot of noise in Wisconsin, just tootling on my own down in Madison. Imagine the noise just by the time I get across California, how huge what I'm doing will become. So to do this though, I need 5 people. I need someone to help drive my RV. I got Winnebago is going to loan me a Class A handicap accessible RV. Awesome. I need somebody to drive my van because somebody plays leapfrog with me all day. I'm going to drive for 6 to 8 hours a day, not just 2. We'll bring extra sets of batteries to swap out along the way. But and whoever drives the RV in the van doesn't want to spend all day alone. So we want them to each have a companion. So that's 4 people I need for my team right there. And we just talked about the dogs and stuff. So I need a 5th member to be a bike rider with me every day. That's a huge ask because it's going to take me about 140 days, I think. About 4 months, I think I'll be on the road to go from the Santa Monica Pier to Capitol Grounds in DC, and then up to a suburb of Boston called Lynn, Massachusetts, where a guy named Matthew Eddy, who's no longer with us, drove from there to LA just to drive across the country.
Okay. So watch for Carl. And if y'all want, like, we could tag team it, y'all. There's no
Yes.
reason to couldn't.
Yes, some people can come with me for just
Yeah.
a county or a week or
Right.
whatever. Just
I just opt out of the Nebraska. I don't want to be the Nebraska driver. Just to be selfish. It's so long and not so fun. All right. Anybody have any other thoughts or questions? You guys have been great. Do you feel inspired? I don't know. Waiting for the vibe to come on. We can do it. No, you're doing great. So if you have, I'm gonna feel free to take the little worksheets that have some prompts on there. Lisa'd be really excited if you'd fill out a survey so we can give that to Phil. I would be thrilled to hear from any of you at any time, as would Stacy Ellingen at In Control. Just want to say, if you've got an idea and you want to do something, that is why we exist. We have grant writers and all kinds of folks who get in good trouble, as we say. All right. Bye, friends. See you soon.
thanks for having me.
Thanks for being here.
Thank you.
You two should go meet up at like Mims in Menasha or something.
Oh,
I'm down.
it's happening.
I'm down. We'll be in touch, Carl. Thank you so
Oh,
much.
for sure. Great to meet you.
Bye, guys.
Likewise.
Thank you guys very much for